So, what are we looking at?
Tell me about this patient that you scanned.
Yeah, sure, Atul. So I'm going to show you a case of a patient with a previous history of chest pain, followed by a shortness of breath.
Okay.
And so the cardiologist asked for a cardiac CTA to rule out coronary obstructive disease as the cause of the symptoms.
Okay, so it looks like we're looking at a coronary CTA and it looks
exactly
pretty good.
Yeah, it looks good. This is the conventional reconstruction that we perform with a spectral CT. And as you can see, we can look at the beginning at a conventional reconstruction.
So you did it with a spectral CT scanner, but
Exactly.
you're starting by looking at just a conventional CT image.
Exactly. This is the first pass that we are used to do when we checked a cardiac CTA. So the cardiac CTA is quite normal. Within this conventional reconstruction, we can check out the coronary arteries, and there is no atheromatosis, there are not significant stenosis as the cause of the symptoms of the patient.
Now, if this patient was scanned on a conventional CT and was having a CCTA, that would be it. No evidence for coronary stenosis, and the patient would leave the hospital.
Exactly.
But you did this on a spectral, so I suspect you're going to show me some spectral images then.
Exactly. As you can see, we perform a late enhancement study, and we can perform it as the cardiac MRI, but we use iodine. So this is an extra acquisition we perform after the coronary angiography, and I'm going to show you the monoenergetic map with low kiloelectrovolts. That is a specific map that you can use just with spectral CT and can improve your contrast resolution.
So low mono E, for those that don't use spectral, helps you enhance the iodine imaging?
Exactly, and improve your contrast resolution and lets you to see the myocardium and to look if there is some late enhancement and to perform a tissue characterization.
Okay, so we're looking beyond the coronary arteries and we're actually looking at the myocardium here. And
Exactly.
I'm already starting to see some hints of enhancement, it looks like.
Exactly. This is a step further than the coronary CTA, and as you can see, we can. It's very clear that there is late enhancement in the apical segments, especially the septal apical segment.
Can we do other types of imaging with spectral to better evaluate this?
Yeah, that's sure. We can perform other maps. For example, I can show you the Z effective map. That is a colored map based on atomic number that can confirm that there is something over there in the septal apical segment. And we can perform also a quantitative map. So the spectral CT is also quantitative, not only qualitative. And ECV map is a map of the extracellular volume that we can, in which we can confirm that there is a myocardial fibrosis. So at the end, this patient had a MINOCA, a myocardial infarction without obstructive coronary artery disease.
Coronary artery disease. That's
Exactly.
an amazing diagnosis to be able to make on a CT. And
Exactly.
even extracellular volume maps, we use them in cardiac MR all the time, but are there advantages with the way you acquire with CT versus MR?
Yeah, the advantages are that you can save time. So in this patient with a coronary CTA, the patient will be gone to the cardiologist without a diagnosis. That because the conventional CTA, it was normal. But we can add this value. We can perform more diagnosis with a late enhancement study. So the main advantage for the patient is that the patient doesn't have to wait. A waiting list that sometimes can be very large, and doesn't have to perform another MRI scan with another contrast that is not without risk. So this is there are very important advantages for the cardiologist that as a diagnosis and for the patient too.
And it sounds like, at least in this case, if this patient was scanned on a conventional CT scanner, they probably would have been sent out of the hospital with a normal coronary CTA.
Exactly.
But in this case, you were able to make a diagnosis first time right and change management, I suspect.
Exactly. For this reason, it was very useful for the patient and for the cardiologist too.
What excites you most about spectral CT?
Well, Atul, the truth is that we are very happy working with spectral CT. That's because we can perform a lot of diagnosis more. We can change patient management because we are changing diagnosis. Like in this case, a normal patient transformed in a patient with pathology. And we can save contrast, we can reduce radiation dose, we can save time for the patient, we can perform diagnosis with higher sensitivity and sensibility. So we are happy to work with it. That's because when you can perform such diagnosis, you are feeling that you are going well your work. You are working good. You are doing the best for the patient and for the clinician and for the healthcare. So for this reason, we are happy. It's very exciting to work with the spectral CT. That's because it's changing and is an evolution of the radiology and the conventional CT.
Great case. Thank you very much. Really
Thank
wonderful.
you. Thank you to Atul.